Good afternoon and good morning to those joining us out west. I'm Karen Langdon with the National Emergency Management Association. Welcome to the NEMA Empowerment e-learning series. NEMA is very fortunate to include amongst its members some of the most experienced and knowledgeable experts in emergency management, and we're very excited to bring you this series and help share their wealth of knowledge and work towards a more prepared and ready nation. Today, we're happy to present Disaster Case Management Resource Navigation, supporting survivors during and after a disaster. It's my pleasure to pass the session to our moderator, Dwight Graves, Executive Director of Public and Private Partnerships at National Emergency Management and Response. Welcome, Dwight. The floor is yours.
Great. Thank you, Karen. Thank you. Good afternoon, everyone. I do again want to thank you for joining us today. And she mentioned my name is Dwight Graves, and I serve as the Executive Director, and I call it P3, but Public-Private Partnerships with National Emergency Management Response. As she mentioned, I will be the moderator today, so I will take us through this intro and then introduce our speaker that we have with us today. But before we get started, I did want to take a few moments to introduce you to who National EMR is and give you an overview of kind of what we do, who we are as a nonprofit. National Emergency Management Response. We're a leader in providing emergency management services. We specialize in disaster response, recovery, continuity of operations. For a little over 22 years, previously known as BCFS Health and Human Services and now National EMR, we have been dedicated to ensuring that communities across the nation are prepared for the unexpected, can respond swiftly to crisis and recover effectively. And this is from all types of disasters, as we all know and are seeing. That's whether it's natural, technological, or man-made. Our mission is clear. It's to safeguard lives. We protect property and we expedite recovery. This is to impact the communities. We do this by delivering what we have aligned, which is rapid, efficient, and tailored emergency management solutions. We achieve this through a combination, the way that we're structured, a combination of proactive preparedness, real-time operational support, and rapid recovery efforts. I think a few things that the key features that set us apart is in the way that we operate and the way our capabilities are set up, we can provide comprehensive disaster response. And that's from initial assessment, planning through full-scale operational response and recovery. Uniquely, National EMR provides a 24/7 support to both state, local governments, and cities or municipalities, ensuring that we have effective coordination to all agencies involved. Our deployment readiness and rapid response planning and process helps us with what we have in our cadre, which are a highly trained deployable workforce. This is dispersed throughout the nation. They're ready to mobilize at a moment's notice. Our teams are equipped with the latest technology, are experts in the complexity of large-scale incidents. This is including coordination with federal agencies or state agencies, NGOs, along with private sector partners. In addition to that, we are able to do customizable solutions based on the state or local government needs. We understand and we have experience through the Hurricane Helene as well as Milton, and over the years, that each locality has its unique challenges. Our approach is always tailored to meet these specific needs, whether it's coordinating shelter operations or conducting damage assessments, as well as providing logistical support, as well as managing critical communications during an event. And lastly, one of the key things is that we have a proven track record. Over the years, National Emergency Management Response, we have led and supported responses and recovery efforts in various major disasters. This is including hurricanes, wildfires, floods, of course, the pandemic response, and this is in all phases of emergency management, from mitigation to long-term recovery. I hope this has provided you, again, just a summary and some insight into who our organization is. We are uniquely set in this space. However, but we're here should you need us, and we'll get into that a little bit afterwards, and if you have any additional requests or information after we get through this. Now, to move on to the most important piece, moving on to our webinar, I'm thrilled myself to introduce our speaker today. Is Miss Lisa Amaya. She's the president of National Emergency Management Response. Lisa, with over 23 years of expertise in emergency management and healthcare preparedness, Lisa has been at the forefront of disaster case management. She's been providing vital support to case management and mental health personnel. This is while seamlessly integrating them and some insight into who our organization is. We are uniquely set in this space. However, but we're here should you need us, and we'll get into that a little bit afterwards. If you have any additional requests or information after we get through this. Now, to move on to the most important piece, moving on to our webinar, I'm thrilled myself to introduce our speaker today. Is Miss Lisa Amaya. She's the president of National Emergency Management Response. Lisa, with over 23 years of expertise in emergency management and healthcare preparedness, Lisa has been at the forefront of disaster case management. She's been providing vital support to case management and mental health personnel. This is while seamlessly integrating them
Bella, get in here now.
Integrating them into the incident command system. She's a master exercise practitioner. She has a master in healthcare administration and holds certifications in mass care planning, national preparedness, and as well incident management. Additionally, Lisa brings extensive leadership experience, and these are managing type 1 to type 5 incidents. In today's session, Lisa will cover and share valuable insights and best practices that we have learned over many responses in disaster case management. This is addressing nationwide challenges across all phases of disaster response and recovery. And again, I thank you for joining us for this opportunity today to share this with you. At this point, I'm thrilled to pass it over to you, Lisa Amaya.
Thank you, Dwight. Appreciate everyone on the call today. Again, I want to stress the importance of this webinar is just based on our best practices, what we have witnessed or encountered. Of course, this is not going to be an exhaustive list, as I know everybody here is an expert in their own field or has witnessed their own experiences as well within disaster case management. In addition, this audience is primarily for emergency management coordinators in particular, on understanding the pivotal role of disaster case management, how it plays within operations, not just in response, but also in recovery, in order to how we engage on the best efforts of meeting survivors' needs, working with community members, etc. So I just want to be sure I highlight that as well. So we'll go ahead and start with the overview of disaster case management. As we all know, it's a key function in disaster recovery, helping survivors navigate the complex process of accessing resources and support. Effective DCM requires the integration of technology tools, scalable frameworks, and strong coordination across all levels of government. This session will explore strategies to maximize DCM's impact, enhance coordination, and build long-term recovery resilience. Some of the key objectives, as you see there, one is to maximize the use of disaster case managers to assess survivor needs and connect them to resources. The next is to learn best practices for DCM that are scalable and adaptable at the state level. Third is to strengthen coordination with local, state, and federal resources for effective recovery. 4 is to optimize practical insights to optimize disaster response and recovery, including leveraging national and regional networks. And 5 is to leverage community resilience by building long-term recovery frameworks. For clarity, throughout this presentation, we will be using Resource Navigator and Case Manager interchangeably. Both terms refer to the same role, where the focus is guiding individuals through the support services and resources available to them. Next slide, please. All right, best practices for disaster case management. Go ahead. So the primary function for disaster case management professionals are essential for accessing survivor needs and connecting them to appropriate resources. They act as a bridge between disaster-affected individuals and recovery services. The best practices that we have witnessed is immediate integration of case managers should occur at disaster response efforts from day one. Assigning case managers to shelters as soon as they open to start assessing needs and offering support. The next is proactive engagement. Case managers must be involved in the survivor's registration process to conduct immediate needs assessments, ensuring early identification of critical needs. And third is real-time data access. We need to equip our disaster case managers with tablets and mobile phones that allow for immediate data input, enabling real-time updates and effective tracking of survivors' progress. Integrating disaster case management into shelters is very critical, especially during registration and doing it early, because then we can get those assessments done right away. It makes that immediate contact occur with survivors that are walking in that door. There's no need to wait for disaster recovery centers to open, although they are effective and useful, and we've seen that occur in the past. They don't implement or stand up early in a disaster. So beginning disaster case management activities immediately, even before DRCs are operational, is essential to support that survivor. Next slide, please. I need to emphasize that disaster case management must be integrated within the ICS or the Incident Command System framework to provide a coordinated, streamlined response to survivors' needs. Local emergency management organizations must lead disaster case management operations. It is essential that EOCs and government agencies lead disaster case management operations rather than leaving it to individual communities. Why? Because DCM is a critical component of disaster response, requiring a unified, coordinated effort across all levels of government. Centralized leadership ensures situational awareness, consistent operational procedures, and access to state level resources. It allows for a coordinated response, ensuring that gaps are mitigated and the resources are identified not just within one county, but across the entire state. One entity in one direction is what is needed. Having a single coordinating body ensuring a unified front when managing the disaster recovery process is essential. This centralized approach helps streamline funding allocation, attract media attention, and ensures the recovery is fair, efficient, and comprehensive by providing transparency. If we integrate DCM operations under ICS, there's a common occurrence that will happen that will show massive improvement. One is to be flexible. Within the ICS structure, you can scale up or down depending on the size of an incident, and how caseloads are managed is the same way to ensure quality support for each survivor. Flexibility in scaling that structure is critical to meeting operational needs. Case managers operate under the ICS framework to ensure coordinated efforts across all emergency management sectors. An example of that is if we integrate them not just under operations, but in logistics and planning. Logistics can support all of their needs outside of supporting the survivor by ensuring that they have the lodging, their equipment, their platforms that they're assigned to them, while the planning section can also ensure they have effective reporting, making sure they have proper state standard operating procedures in order to continue their operations to support that survivor. That means they are able to provide immediate support to survivors, ensuring timely access to resources. Also, span of control and case load management is critical in order to maintain a manageable caseload to ensure effective support and timely recovery. This flexibility within ICS is scaling that structure to meet operational needs. Here's an example. Within our program, our standard ratios dependent on the incident can range from 20 to 30 cases per case manager. But there are some situations in which the case work could go up to 30 to 90 days. So it depends on how you are working operationally. However, for evacuation or post-disaster shelters, it's much more urgent to get the person out of the shelter and be sure that they have the needs identified and assessed and met. That means you would have less cases per case manager so they can work on getting them out faster. EMR operates under a NIMS ICS compliant structure, ensuring effective case management control and resource allocation during response efforts. If you treat disaster case management as an emergency rather than as a routine operation, which it is not, you will achieve quicker and more immediate outcomes. Next slide, please. Okay, as you see here, we utilize a standardized incident operational structure for managing all incidents, regardless of the hazard. Case management is integrated within the operations section and follows the planning P. By aligning ourselves with the same battle rhythm, communication platforms, resources, and locations, we create a unified and cohesive operating picture. Deviation from this structure is not the best practice, as it creates silos within a team that shares a common goal. Case managers should not be seen solely as social workers, but as diverse professionals who learn the incident command system. By helping them understand ICS terminology and processes within emergency management, we empower them to think and operate like emergency managers. Next slide, please. Resource coordination centers. It's not the best practice to operate without incorporating the structure within your plan. Disaster case management alone is not sufficient to assess survivors' needs. It requires a large network of resources and dedicated teams working closely with both government agencies and communities to identify these needs collaboratively, rather than focus only on individual case management. Resources must be continuously adapted as survivors' needs evolve. A centralized database is recommended to avoid resource exhaustion and duplicate efforts. Now, the purpose and benefit of RCCs, one, that they streamline resource access. RCCs simplify and expedite connecting survivors with critical resources. They enhance survivor support, providing a flexible, scalable approach to assist survivors whether they are local or they need to relocate. Commitment to recovery and resilience. EMR's extensive experience with national network ensures that survivors receives these needs assistance regardless of the location or disaster scope. One of the critical things on the role of the RCC and the impact is twofold. One is vital support for case managers. The RCCs play a role in identifying and connecting survivors to resources quickly. Case managers need to case manage. They need to work with the survivor, ensure that they're getting their needs met. As we stated, their needs evolve. A case manager cannot also identify resources. That's a separate operational need. So one of the reasons why the RCC is critical is to access those extensive networks by tapping into not just state, but regional and national resources, including housing, mental health services, and other financial assistance. This allows that the RCC is able to support survivors by identifying those resources based on the needs that the case managers are providing them, allowing to see what those trends are, and then working towards identifying more resources based on the ones that have the higher trends and needs. A great example is Hurricane Maria in Puerto Rico in 2017. Next slide, please. Here's a case example of when we worked in Puerto Rico for Hurricane Maria. As you can see from the challenges and our response and outcome, we had over 50 case managers within 5 states supporting Hurricane Maria. The reason why I add Puerto Rico here is one big example as to how extensive case management can operate in multiple locations if we don't have a common operating picture under ICS. And how critical an RCC is essential when you're working with multiple states instead of one state. When all information is feeding up to one center, you're identifying resources in multiple states. This RCC helps with this initiative. We had over 225 days in this operation, helping over 1,000 evacuees. What we implemented, which we'll talk about in a moment, is a 24/7 call center where all information was going up from survivors and providers to ensure we're providing one common operating picture. But again, with the complexity and the scope within this disaster, integrating into an RCC is very critical to ensure that you have separate roles for your case manager as well as for your resource coordinator. Next slide, please. All right, personalized case management for effective recovery. So as you see here, comprehensive support and protocols are essential. But one of the key takeaways is that enabling case managers to provide personalized support by addressing survivors' needs and ensure timely follow-up is allowing them to case manage, but to case manage effectively by ensuring that there's processes in place where everyone is doing it consistently. The approach is to use SMART goals to create clear recovery pathways for each survivor with a focus on deliverables, communications, situational awareness, and setting expectations based on the incident size, scope, and duration. The importance of this is that without these guidelines in place, inconsistency, frustration, and miscommunication can negatively affect survivors. Clear, written, and trained expectations ensure everyone is aligned with benefits, which benefits the survivor as a whole. Some examples of barriers and SOPs. So when you get into a response, if we clearly identify barriers, for example, you have low barriers, medium barriers, and high barriers. People sometimes operate on a color system, red, yellow, green. Green being your low, red being your high. So if we establish that the green low barriers are quick support, up to 10 minutes for intake, minimal referrals, we can establish that as green. For yellow, medium barriers, we say that that's ongoing support, takes up to 30 minutes to complete intake, assist with housing and resources. And red, high barriers, extensive support, 45 minutes to 6 minutes for intake, securing housing, long-term support. If we establish those ahead of time with our case managers, that will allow us to create a tiered process on identifying trends with those barriers to assist and at least identify, okay, at least they have some parameter that they're utilizing, which is consistent with our reporting and how we gauge on supporting that survivor. Some standard operating procedures to think about and to ensure we have consistency. One is case documentation. As we all know, for our case managers, everyone documents differently. But having guidance on what we want to clearly ensure or train our case managers to document is critical. So having an SOP would be essential to ensure documentation is done effectively once we work with our survivor. Case triage and transfer. Transfer is critical because you're building that relationship with that survivor. So the transfer on how you do that is we need to be sure we're consistent and that we're supporting that survivor by entrusting to another case manager. Intake assessment and rapport building, and then supervisor case evaluation. One of the biggest things on developing cases is being sure you have someone outside within your, than just the existing case manager reviewing your cases to be sure that you're in compliance, doing your checklist, and being sure you're doing that essential QA with those the case work that's being conducted. Next slide, please. Effective resource management and coordination. Resource management and coordination. A big thing is that many individuals have seen or stood up a multi-agency resource center, a MARC. This is an efficient for delivering services by bringing together multiple providers in one location. However, challenges like accessibility, hours of operation, and transparency must be addressed for success. Addressing those gaps is essential so MARCs can be valuable to the survivor, but they often lack proper communication with survivors and service providers about existing gaps, whether minor or major. The follow-up success is not always noted, and when services are no longer needed. Solving those gaps take time and planning. The solution that we would like to promote as a best practice is implementing a 24/7 call center for survivors and providers to streamline communication and ensure effective case coordination. This provides clear communication channels from the bottom up and supports providers and gathers data to identify trends and resource gaps. The key takeaway here is that there's quick access to resources is critical for effective recovery. And we need to be sure that if we establish any physical location, there's always going to be gaps that we may not be reaching every individual that may need some type of service. So implementing multiple ways to communicate with individuals is always the key so we can reach as many people as we can. But we need to be sure we have plans in place when we establish those physical locations. But we also need to be mindful of how we feed that information so we all have the same information, understanding what those trends are, making sure that a survivor is reaching somebody, a live person, 24/7 to at least get an information on their case as to where it's at, and or providers on where they can help and understand what the gaps are and if there is any services that they can provide or not. All that has to be considered in order to have effective resource management and coordination. Some of the community engagements that we can ask ourselves is, how do states and local directors coordinate state, local, and federal resources to avoid duplication and meet survivors' needs? And how do you assess the effectiveness of resource identification and coordination efforts to ensure resources are used effectively? Next slide, please. Key steps in resource navigation. Resource navigators assess survivor needs, identify service gaps, and connect them to appropriate local, state, and private resources. They are a direct link for survivors to trusted agencies offering services such as shelter, financial aid, and mental health support. Regular follow-ups ensure that resources meet the survivor's need and are effective. If any issues or delays arise, resource navigators escalate them to leadership for prompt resolution. Resource navigation is about providing consistent trauma-informed support. It's a consistent process. An example is continuous follow-up ensures survivors receive ongoing assistance and any challenges are quickly addressed. So resource navigation doesn't need to be complicated. It's just about consistency. By working with survivors daily, it becomes a routine process that builds trust and accountability. This fosters a partnership where survivors are also empowered to take responsibility of their own recovery. Next slide, please. In addition, one of the best practices that we have learned is integrating mental health support within disaster case management. Mental health professionals, such as clinicians at shelters or within the case management team, are integrated to support crisis intervention efforts. While case managers are trained to de-escalation techniques, having a dedicated mental health expert ensures specialized support for more severe emotional or psychological crisis. This integration strengthens our ability to address urgent mental health needs, offering an added layer of care for survivors. It's essential to integrate various disciplines to provide comprehensive services for survivors within emergency management programs. This is just one example, and we're open to other approaches based on your experiences. Next slide, please. So here's a case study. We supported Uvalde, providing resource navigation services to families in Uvalde, ensuring immediate and ongoing support through personalized connections to critical resources to ensure that they were met. Some key action items that were addressed is resource connections. While families were already connected to state, private, and vetted local agencies, we provided dedicated on-site representation to only address what was still outstanding to those families to ensure resources were available and there was no lack in support or unmet needs. Navigators checked in with these families through cell phone or virtual meetings to ensure successful resource connections and continued support. It was at the family's discretion as to how they wanted to be connected. We were flexible with the navigators during set hours to be able to respond to them, as well as have an on-call support 24/7 to ensure continuous assistance for those families. The families also received tailored services addressing their unique recovery needs. And of course, ongoing support allowed families to transition out of case management as their needs were met. Now, just to clarify for this case study, is that this event focused on addressing immediate needs within the defined scope. While resource navigation is a consistent process, it's important to recognize that survivors' needs may not always be directly tied to the disaster's impact, and that's okay. Effective navigation involves understanding these needs and guiding survivors to the appropriate resources for their long-term recovery. Next slide, please. Community success and disaster recovery. Community success and disaster recovery refers to the ability of a community to effectively and sustainably recover from a disaster by meeting the immediate, short-term, and long-term needs of its members. It involves the collective efforts of local, state, federal, and non-governmental organizations, as well as the active participation of the affected community members. It is important to focus on both immediate responses and long-term recovery goals. Here are practical, tactical, based on the key components of community success and recovery. We all know what community recovery looks like. Every community is different. But for some of the things I want to be sure that we focus on is what are the tactics? What are the examples that we can focus on, then understanding what the immediate needs are as a whole? I'm not talking about theoretically, I'm talking about what I've actually seen or what I think is in my terms of emergency management, what would be best on ensuring that we have community success based on the experience I've witnessed. And one is first is the time and effective response. An actionable tactic is that deploying case managers as stated immediately to assess individual and family needs, ensuring essential services like shelter, food, medical care, and emotional support are delivered promptly. An example is that as soon as a disaster strikes, activating case management teams to begin conducting initial assessments of survivors' needs within 24 to 48 hours, ensuring that survivors are connected to those services without delay is essential. That's one example. The next one is collaboration and coordination. A tactic is, as we stated, establishing an RCC or a MAC, group early in the recovery process to streamline information sharing and resource allocation among federal, state, local, and nonprofit partners. An example is to implement a shared case management database and set up regular check-ins between case managers, local agencies, and nonprofits to coordinate and track resource distribution, ensuring survivors are not left without support and are served multiple times by different agencies. The next one is community engagement and empowerment. A tactic is to empower community-based organizations to actively participate in the recovery process, ensuring local knowledge and resources are tapped into. An example is to identify and train community members and volunteers to serve as liaisons, working alongside case managers to ensure the needs of the community are represented and met, engaging the community in identifying gaps and offering solutions for unmet needs. And the last one is addressing long-term needs. A tactic is to develop and monitor long-term recovery plans for survivors, particularly focusing on housing, employment, mental health services, and economic recovery. An example is to create a case management system that tracks long-term recovery needs and ensures follow-up after immediate needs are met. Case managers should check in regularly with survivors to assist with securing permanent housing and employment opportunities. Next slide. Effective communication strategies. It is true that DCM thrives when emergency management and partnering agencies align with a common goal, the survivor's recovery. The key to effective collaboration is clear, consistent communication, where the how, when, where, who, and what should always be unified, even though this can be challenging. To facilitate this, the collaborative tools must be carefully researched and chosen to support you, community agencies, and case managers, ensuring smooth communication and resource sharing. Integrating agencies under the Planning P and the Incident Command System, ICS, promote ongoing coordination, streamlines information sharing, and keeps all parties aligned on the same objectives. The key principles for collaboration and communication is the way case managers and emergency responders communicate with survivors is critical to building trust. Using compassionate, transparent language and prioritize active listening to ensure survivors feel supported throughout the process. Setting up frequent meetings with partnering agencies to ensure all parties are aligned and updated on the situation. And then, of course, implementing collaborative tools, sharing platforms such as dashboards, reporting systems, or case management software to keep everyone informed and working from the same data, reducing duplication and enhancing efficiency. Next slide. So an example of a platform that supports ongoing response coordination and collaboration that we use is WebEOC, which is what we have used for tracking and managing operational workflows during disaster response and recovery. It plays a critical role in providing high-level overview of disaster response and recovery activities. How we utilize it to support collaboration. The first is real-time workflow tracking. WebEOC allows case management teams to track the progress of cases through each operational period, providing an up-to-date summary of cases that are open, in progress, or closed. The platform also shows the barriers to recovery by categorizing cases by severity or level of need. This enables case management teams emergency management teams to quickly see where additional resources or focus is required. Using this data, emergency management can prioritize and direct resources where they are needed most, ensuring a targeted, effective response based on real-time information. By utilizing WebEOC for these purposes, emergency management and case managers are able to stay aligned, coordinate their efforts, and make informed decisions that address the immediate needs of survivors effectively. Again, this is only one platform that we have used to support DCM operations, not the only platform. Next slide. For emergency managers, effective disaster response must be culturally sensitive and inclusive, addressing the unique needs of diverse populations to ensure equitable recovery. Here's how to achieve it. As communities become more diverse, a one-size-fits-all approach to disaster recovery is no longer effective. Understanding cultural, linguistic, and social dynamics is critical to building trust and encouraging survivors to seek help. An example is that in Hawaii, cultural resistance to external help is common. So case managers must understand local cultural values to establish trust and engagement. Improving community engagement, case managers should tailor their approach by acknowledging cultural expectations, ensuring communication is culturally appropriate and available in multiple languages. The key question that we need to ask ourselves, especially for case managers when they train for a particular response, is, are we reaching the community in the way they understand? This includes offering translated material and adjusting how services are presented. Inclusive service delivery. Investing in cultural sensitivity training for case managers allows them to engage effectively with diverse communities, building trust and overcoming resistance. An example is after Hurricane Maria in Puerto Rico, outreach efforts in both Spanish and English ensure that survivors from different cultural backgrounds receive the necessary support. Evaluating reach and effectiveness. As I stated before with the marks, we need to assess whether the intended community is accessing recovery services by tracking participation at centers like RCCs, DRCs, or marks. Low attendance may indicate cultural or logistical barriers that need to be addressed. An example, as we have all witnessed, especially during Hurricane Katrina or saw, outreach through community organizations and cultural relevant support helped overcome barriers to participation in recovery services. Now let's address the elephant in the room. This process is not easy for anyone, and it's important to acknowledge that while local case managers may have better knowledge of their communities, they may not always have the skills to effectively manage cases, especially if they've been impacted by the disaster themselves. It's critical to balance local expertise with professional case management support. Everyone's approach won't be the same, and cultural sensitivity disaster recovery will require effort. It involves adapting communication strategies, training case managers, and actively ensuring that all community members can access the services they need. This is an ongoing process that demands flexibility and collaboration. In summary, cultural sensitive disaster recovery means understanding and respecting community dynamics, training personnel, and making services accessible to everyone, all while acknowledging that the process can be challenging and requires adaptation. Next slide, please. So for the Maui wildfires, this is a successful example of cultural sensitive disaster recovery. In this case, the community welcomed us with open arms, allowing us to learn about their culture and better understand their needs. Their transparency about their capabilities and willingness to accept external support set the stage for a successful collaboration. We weren't just providing aid. We were integrating within the community, working side by side with local members as part of their recovery team. This is a prime example of how a community willing to ask for help and open to new ideas can create a collaborative and effective recovery process. The community was deeply involved in how we operated, and they learned from our methods, including case management best practices. As a result, we successfully transitioned out, leaving them with the skills and knowledge to continue their long-term recovery independently. Through this partnership, we didn't just provide support, we empowered the community to take ownership of their own recovery, creating a lasting foundation for resilience. Next slide, please. Ethical considerations. Next slide. So key things to just avoid. I think we all understand what the ethical compliance and protection needs to be when managing information, especially in any response, not just the survivors, but what we do in a response. So I just want to highlight on what to avoid. Sharing survivor details without their consent and favoring certain groups without clear and fair reasons. I believe that's easy to understand for anyone to at least understand that when we have any information, we have to be sure before we share it, we have to get consent from the survivor. Those SOPs, standard operating procedures, or guidelines within your organization and policies should already be implemented to support those, and those are always going to be a best practice in anybody's book. But we also need to understand the impact of ethical practices. When we maintain those ethical standards, the community's trust in recovery efforts grow, and the overall response is more effective. If ethical standards are not followed, it causes confusion, mistrust, and hinders recovery efforts. By keeping ethical practices simple, transparent, and consistent, we help ensure a smooth recovery process that respects and supports all survivors. Next slide, please. Case management innovations. So leveraging innovations for effective disaster case management. Obviously, we know that technology is big and implementing case management software and communication tools to streamline operations is going to improve on how we operate as a whole. Data-driven decisions is big. As I stated with the platforms that we utilize, if it's real-time information, emergency management and case managers, as well as the community that is working to support survivors, will be able to utilize that real-time data to identify gaps and allocate resources effectively. We also can engage survivors with this type of technology by texting, social media, and apps to keep survivors informed and involved in their recovery. Collaborative platforms like WebEOC, as I showed you, or other platforms that you already currently use to enhance coordination and avoid duplication efforts. Flexibility in this technology allows you to innovate for a quick scale, to quickly scale up or down to evolve to recovery needs. Automation, streamline routine tasks to allow case managers to focus on personalized support. And then, of course, adapt and improve, continuous feedback to refine processes and improve outcomes. I stated earlier about standard operating procedures for how case managers work caseloads and how they go through the planning P. All of that can be flexible and revised and adapt to that current need. As every operation scales up and down, those processes also will be changed to support whatever is scaling up or down within that incident. Leveraging that innovation helps emergency managers deliver faster, more efficient, and more responsive disaster case management services. Next slide, please. Now, if you're deciding on whether to build your local disaster case management capabilities or rely on federal support, it depends on your state's priorities and resources. The approach will vary in terms of speed, trust, and execution. Whether you decide to train your local teams, hire contractors, or seek federal assistance, it is critical to control the operation and set clear expectations for desired outcomes. While we encourage building local DCM capability, it requires time to develop processes, partnerships, and networks that enhance overall readiness. These efforts should be planned before a disaster strikes to ensure operational effectiveness once funding and support are available. Some key strategies for disaster case management is one is to build local partnerships, strengthen those ties with local agencies, nonprofit, and community organizations. 2 is to develop clear processes. As I stated before, with SOPs, establishing those systems for resource coordination, case management, and follow-up before a disaster is critical. Investing in training, ensuring local teams are well trained in DCM systems and operations. And of course, plan for funding. Understand available funding streams to support the training, meetings, and the partnerships that you need to build to increase the capacity within DCM operations locally. These strategies will help improve local readiness and ensure a smoother, more effective response when a disaster strikes. We know that this is no easy task, but as a nonprofit, we're here to support local teams succeed. We want to support local emergency managers to build strong local DCM capabilities so that when a disaster strikes, your teams are ready. Whether it's through training or shared best practices, we're here to make sure that you have the tools and support you need to respond effectively and get your community back on track. Next slide, please. So to conclude, I just want to make sure I highlight on a couple of things, some key takeaways for emergency management. One is that DCM is critical. Effective disaster recovery isn't just about immediate response. It's about long-term support for survivors. Case managers play a critical role in ensuring that the survivors' needs are tracked and addressed through every phase of recovery, from short-term relief to long-term rebuilding. Collaboration is key. Whether you're working with local, state, federal, or non-government agencies, collaboration is the backbone for successful recovery. We must avoid duplication, maximize resource utilization, and ensure all partners are on the same page to help survivors' recovery. Empowering local teams. While federal support is critical during large-scale events, building local DCM capability before a disaster strikes ensures long-term sustainability and resilience. Training local emergency managers and case managers ensures that your community is prepared, responsive, and ready to handle the recovery process with the right support structures in place. In summary, I do want to say that for disaster case management, it's more than a support system. It's a critical operation that ensures survivors' long-term needs are met. Many don't see case management as a tool that could be integrated within ICS. It really is a response component. As soon as we have a response and we deploy our case managers, that will show immediate support to our survivors in the beginning instead of waiting for DRCs to open. I highlight that because I know I'm sure from everybody here in the audience, we see that lack of response, and we want to be sure that integrating it within the ICS structure under emergency management, that it will be utilized effectively just as much as mental health support needs to be addressed immediately when survivors are beginning to congregate to a shelter or they have an impact that's associated with the response. Those are critical resources that need to be utilized, and it all needs to be done in a coordinated effort under our local emergency managers or within our emergency operations centers. They need to have a seat within that EOC so they can provide visibility, their expertise, and understanding of what's going on with those trends to support recovery, whether it's immediate versus long-term. I would like to thank everyone here for your time today. for those entities in supporting and providing emergency services in times of crisis. You all play a pivotal role in leading these recovery efforts, and DCM operations are the backbone of survivor-focused, sustainable recovery process. I really hope that this presentation has provided some value to you in the efforts you would like to change or ensure that your states or communities not only recover but thrive. That's the end of my presentation. Thank you.
Great. Thank you, Lisa. We do have some questions that come up. Abby, would you go to the next slide? All right. So to give you, if you have a moment and wanted to jot down, here is Lisa's contact information, her email that she has available. Furthermore, and I'll tell you on my closing remarks how you can get in touch with us even further if you needed or have follow-up. And I also know from an instructor standpoint, a lot of times people are not necessarily going to ask a question in the chat, and that's fine. You can reach out to Lisa with her email, la0915, and that's at nationalemr.us, as well as www.nationalemr is our webpage.us that you can find out more information on this. So let me get into, because we did receive some questions that I want to address, and some of them will kind of lead into each other. And I'll start out, if I can, Lisa, and you can chime in as you have an opportunity to take a breath, drink a bottle of water. You've done a phenomenal job, and I appreciate that. But from Ms. West, the suggestion you put in the chat, the suggestion that a state lead, that the disaster case management may be different in a state with a home rule. Would you have examples? And I will tell you that there's no doubt it is challenging in a state with home rule. However, I will tell you, California, home rule state, we supported Paradise, if you remember, a very tragic campfire event in Paradise, California. Our case management, disaster case management, supported that for its duration of time. And in doing so, we were able to, and you have to understand that with home rule, that gives autonomy to the state as well as local jurisdictions. So local jurisdictions can implement in a home rule state those measures, and it could be statutes or their rules that they put in place to be able to allow for case management. But either way it goes, it's difficult and it can be challenging to start with if it's being done and realize, we have this gap at the time or following the disaster. For the most part, we push for planning on the pre-stage of this event so that we, again, having the opportunity. Remember, we're a nonprofit. We offer a lot of things that we have and capabilities, and we share because we are focused on the need. We share a lot of information and can help states, entities, agencies that are trying to figure out how to put together a case management program. We can work with you to kind of give you our best practices as we've done here in further detail. But talking about looking at examples specifically in a home rule state, if you already have, and think about this, local NGOs or nonprofits that are established, community health organizations that are already doing case management, it may be that you implement them. And I can tell you that we could fall under as a supporting agency that comes in to help them or assist in that time to expand what their current case management is for the specific need for disaster. So home rule, while it can be challenging, can be overcome. And it was done seamlessly in California. There was no hiccups or no issues when we were supporting Paradise and going through that. But again, realizing that in the home rule, the local jurisdiction at their level can and should design and implement those measures that allow for it to be expanding and taking care of it when it comes to case management. So, Ms. West, if you have any further, or you can unmute and ask any further if you have that, have any when it comes to this question? All right, hearing none.
So White, thank you very much for your response, and you hit it on the nail. I appreciate it. Thank you.
Yes, ma'am. Thank you. All right. So moving on. So Ms. Rock, you asked, what challenges have you experienced with disaster case management when it's not implemented promptly following the disaster? I'm going to tell you a lot on this one. What impacts can leaders anticipate if they don't recognize the timeliness is critical? And this it is a difficult setting, and we're not pointing fingers at any one entity. I'm not going to, and Lisa, you can chime in on this if you want to, but think about what we're talking about here. It's very simply said, waiting to implement case management. And that's why, if you understood and listened to where Lisa talked about National Emergency Management Response, we implement this as part of our day in, day out operational instant command system. And so it's an integral part, not a second thought after, oh my goodness, we've had this disaster. Now we need to implement case management. We have them, as you heard her say, implemented into our command structure, instant command structure, so that they're in there early. However, the delays in the services, you know what it's going to do. And you, I don't want to say, but you can see what has happened with Helene and sometimes in Milton. What does it do? It exacerbates the impact to the survivor, because you're waiting. If you're not if you're not implementing it, and we want it implemented in the planning stages, this is prior to any disaster, and then immediately you have that plan in place. And then ultimately, when you have the event or you're experiencing the event, I can tell you that we supported the state of Florida in implementing case management while the response was ongoing. It was not in the recovery phase. We were already assisting Florida with case management during the response. Why? Because that starts to get resources to those needs that have been identified by the survivors, and it's extremely important. But what it ends up leading to is survivor struggle. As I told you, it exacerbates what they're already going through. But the key thing that we look at, it caused more complex caseloads. Now we have a stacking effect of the events that you're seeing. And when a survivor is looking for just food, and I can tell you in the mass incidents that we've involved with, that it continues to stack those issues up the longer that it takes to get resources and the support to those. One of the key challenges, though, that we observe very quickly is, with that delay, is the loss of trust. And that is essential, as Lisa mentioned, essential to case management, is building that trust and maintaining that trust. But you end up having survivors perceive that the government is not there and they're not doing their job and it's ineffective. And you get a lot of things that happen, as we've seen from the events, whether you were in Hawaii. Lisa and I have attended several opportunities to listen to Governor Green from Hawaii talk about the events and such have gone on, as well as FEMA's administrator, listening to her tell us the things that went on with, and the way that the trust was lost and continued to be tried to be re-engaged back and forth. But let me also allow Lisa, do you have any following comments on delays or implementing, or the timeliness of putting case management in?
Yes, I think one of the key challenges too, I'm sorry. Oh, okay. I just wanted to state that another key challenge that we also, I believe we've seen often, is that losing the trust of the survivor because they perceive government and non-government organization as ineffective and responsive to their needs. So that's always a challenge, because someone has already told their story more than once to more than one entity, and they want their needs to be addressed promptly, right? Everybody wants to go back home, or everybody wants to go back to what they're used to their normal lives, right? Even though we know it's always going to be impacted now from what they've experienced. But putting people out there first immediately, that case management is very, provides that immediate trust and care for that individual. So that also is a challenge because of the ongoing struggle that we have seen, and I'm sure you all have seen in your experiences, because it does require extra effort from service providers and local and state agencies to gain that trust again.
And it can be tough. It can be tough to get it back, and you have to work extra hard. We've seen that time and time again to get it, and then you have to maintain it. And one of those things that we do is we try to keep. We've experienced working with states and local governments that have plans of where they have multiple case managers, one that handles maybe educational needs, one that handles meals needs, one that handles medical. You will find out that we universally implement a case manager to a survivor, and they support all those needs so that they're not getting the redundancy, as Lisa mentioned, of questions over and over, the same questions again and again, which again also leads to distrust. Here I am starting all over again, is that feeling that they get during those times. So we again, understanding the challenges, we're giving you best practices, things to think about. So moving on to our next question, again from Ms. West, have you used a mobile unit, travel unit to provide casework within a disaster community? If so, what was it like? And if so, at what stage was the service no longer available? So Puerto Rico, we implemented that. We had staff on the ground. I call that operational, or we call them in theater, to support directly. It's very effective. Again, it's understanding that you get face-to-face opportunities. Now, in the virtual world, we've implemented that, and we supported that both in California, but we also had some on the ground resources. But in Puerto Rico, because of the extensiveness during Hurricane Irma Maria, we found that it was so much information, so much impact, and so many survivor needs that it was better for us to put our personnel on the ground. It's very effective in some cases. But now remember, you may be working, if you're coming from a state agency, depending on if you're managing this, if you've chosen to take the grant, or if you're allowing FEMA. There's a variety of different settings, because a lot of times, while we can be turnkey solutions, we are the only sole source that provides to the federal government through OSEPR, that we provide case management services that is shared across to FEMA. I can tell you that a lot of times that operational plan comes from the top down to provide us direction as to whether they want us on the ground or whether they are wanting us to do a virtual setting. But either way, we've been successful in both settings. But I will tell you that what I do also find that has been very good is the DRC, the Disaster Recovery Center. We position staff there as well to do case management. And so along with coming to that DRC, and that goes back to what Lisa was telling you, and having a resource center set up like that, and capabilities that also has the DRC, that allows for a survivor to come in and get multiple needs met with one stop, while they established in these DRCs transportation plans that support the survivors coming in and out, being able to come in for their appointment and be able to take care of that. So it's helpful either way. But in addition to, I still have to go back. We've done both on the ground, meaning mobile units, and we've done both as well. We've done the virtual, and we've been successful at all. But you work harder, in my opinion, to build that trust from a distance than you would if you're in front of someone. And you know that it's tangible when they're sitting there in front of you. So the duration, though, Bernice, talking about the duration of time and using these teams, it just depends on how. And I will tell you, Paradise was a very long period of time. And then it was Hurricane, Lisa, correct me if I'm wrong, Hurricane Delta that we were supporting Louisiana, or was it Laura that we were supporting Louisiana during that case management portion of it?
It was Laura. It was Laura,
yeah,
and
Laura.
it was all virtual.
It was all virtual,
case
and we went through some challenges with that, because again, establishing and setting up, that was a FEMA request, that was an activation that came to the federal government. We went through some challenges, but however, implemented, again, understanding this case management was not in a silo. This was implemented in an instant command system. Our established battle rhythm had them involved, so we were coordinating and understanding the needs and getting that pushed up and out to the DRC so they knew what they needed, or local resources were provided to them and the capabilities. How long it lasts can be based on, again, how big of the impact. But Puerto Rico, we stayed there until there was a roll up, and based on our assignment, that all of the survivors were met that were assigned in our geographical area, and then we rolled up those resources and moved them out. Am I missing anything on that, Lisa? All right. And then Heather, is it Van Hunnick? I hope I got that right. Is disaster case management tracking and WebLC a premium board? Well, I hate to pat us on the back, but I will tell you, I'm not sure if Javari has that as a premium board. I'm sure they can make anything you want. The fortunate aspect is that National EMR is a advocate for Web EOC because we use that as our primary command and coordination and communications platform. And so we have engineers, critical information system team that are engineers that develop those boards for us. And so that's an internal board that you saw a snapshot of. But I'm confident, and here's the other thing, we can give you the variables and would share the variables of what we are tracking when it comes to case management. I know that's something openly, again, I tell you as a nonprofit, we're here to meet the need. We're not focused on trying to keep something. We want, if you can make you better, and we have that, we'll share that information with you. But I'm sure that Javari can build because our staff are the same level of staff that they have. If not, I'm going to be a little bit biased and say they're better than what Javari has, but our folks are capable of building what Javari builds out. And that, again, for everybody there, that's Web EOC that they use. So again, I'm not sure that they would have one specific, but if you got the variables from us and wanted to go back to them to get something, they would probably build that for you. I just don't know a cost or anything along those lines. So we'd be glad to share more information if that's something you wanted. Hopefully that answered your question. If not, hit back in with a chime where you can open up, unmute. All right, so looking at, Bernice, you got another one. Has National EMR been an ESF 6 or 14 partner at the EOC? Also, how have you worked with FEMA, Red Cross, and United Way? And understanding the partnership, looking at us in the way that we do, we provide a service, so we're an operational aspect, we're an operational resource. We offer turnkey solutions when it comes to ESF 6 and 8. So the interesting thing about us is we own National EMR. We have our own resources when it comes to, we manage federal medical stations. We manage alternate care sites, mass care capabilities, all those things, and we own those resources that we have. So we become, and I want to tell you, we really don't see ourselves as a vendor in some cases. We see ourselves, we try to model after a partner. You need something, we're going to get it for you. And so how we coordinate and work is that we do, as I am one of them, is we implement ourselves in a manner that gives direct coordination. So during Hurricane Laura Delta, where'd you find me? I was the L&O for National EMR. Then we were under the name of BCFS Health and Human Services. I was there at the EOC, implemented as a resource, so that activated as a resource to support them with immediate needs. So they'd ask, I'd be able to reach out to our instant command structure that was established. We run a state-of-the-art EOC. Our headquarters is there in San Antonio. That allowed for me to implement very quickly, or for them to implement get an idea of what we had and implement those plans very quickly into whatever they were needing them for. And we continue to do that now, as I just recently returned from the state of Florida during Milton and supporting with some shelter support resources going forward. And we do that to continue to be a partner. That's the way it should be done. And hopefully, as you see with other agencies, the importance of doing that, because they know, as a project manager, I'm right there to give them the answers to anything that they're asking for, and very quickly to move 160 personnel downrange to Florida in just less than 12 to 24 hours to help them with sheltering. That makes a big difference to implement that. So when it comes to partnerships in the business sector side of it, we support a variety of different, and we partner with a variety of different private businesses, nonprofits as well. And we have alliance members that we all work together with to support needs as they come up. And we have alliance agreements in place that allow us to reach to the side to get something, a widget that maybe we don't have, or to support other entities that are looking for resources. As I told you, we have a large inventory, $100 to $200 million worth of resources that we have with buses and such, and mobile command platforms and things like that we share. So we have agreements that we continue to work with. Not only that, as a nonprofit organization, one of the other things that we do is we have emergency services agreements with local governments, that's counties, that could be state agencies as well. And it's really just a non-binding agreement that lets you go fast. If you need to call us, we already have the paperwork done and we can move on that. So in Red Cross, we work with Red Cross in every one of the responses that we have in some way, shape, or form, whether it's collaboration. Down in Florida, we opened joint shelters with them. We helped staff some of the shelters that were open. United Way, Lisa, I'm not familiar working directly with United Way other than we've had phone calls or discussions about resource sharing in the past, but nothing recently. Are you aware of any?
Yes, for Maria, we had to work with United Way for call centers. So 211, 311, depending on the state that we worked with within those 5 states. We collaborated with them. So if we had a call center, it'd be best to work with those entities when they're receiving calls to notify them of what we do and our phone number, so then people can call us and for those things. So integrating them, so we work with them collaboratively on that.
Okay, and we're getting to our last question here. Are there funding resources that you would point to for communities looking to build this capacity during a disaster? I know that the UASI grants that used to be out there, that some of that is still in play, but it's in the larger cities that have those joint groups that are still urban initiatives, basically, that are out there coming. But there's also emergency management performance grants that you can look up. There is a pre-disaster mitigation that FEMA does that they put out annually. That also, and again, we're not grant managers. We, again, as a nonprofit, monitor what's going on, but there's a variety of different ones out there. Building resiliency and infrastructure for communities. I can tell you that you can find funding, a variety of different funding grants that allow for communities to begin building that. And I will tell you that we're seeing a huge push in resiliency after what we've seen. No doubt that we've seen that the increase of disaster responses to go roughly 50% more than what we've had. So from average, speaking with the governor from Oklahoma, last week, I had an opportunity with Governor Stitt to sit there and say, well, tell me about the impact in disaster response. And understand Oklahoma, central U.S., above Texas, predominantly the tornado belt, as we know, a tornado alley. Basically said that I've seen a from 4 to 8 now events a year, major events, major impacts, and some of that being tornadoes, some of that being flood. Now we're seeing we're transitioning into the wildland fire arena time of the year that we see a lot of that. But understanding that you're looking for opportunities out there, and resiliency is the big key that I'm seeing coming out of from ASPR and FEMA as well. And hopefully those block grants moving forward will have the opportunity for you to look at doing planning and being when it comes to resiliency. That's something we do and support and believe it's very important, because that's where you're going to find in the world of case management is to remember the most. One of the key things that Lisa mentioned is don't wait to the events in your recovery mode or the responses in the recovery mode to implement case management, because you think about the duration of time, particularly and I use Helene because of the magnitude of the impact from that, and us being involved in knowing many things that were going on, that they're still in the recovery mode or still in the response mode in some areas and move to recovery. But we're almost a month past that, and recognizing that if you're waiting to implement case management after that, look at what that survivor has gone through from this time to this time, and their trust level at the time you do implement that could be very difficult to get that. So with that said, is there one last one? I do see that. Has there been an issue with duplication of services and resources to the survivor? I would say that happens, and it happens quite often. And a lot of that, looking at it, comes from a multitude of reasons. Some of and I'm going to give you my experience, Lisa, prepare to chime in, but you start, stop, or you've implemented programs that are starting. And I mentioned to you earlier in the home rule where you may be teaming with an NGO or another local entity that starts case management, then have a federal grant that comes in to support it, and you implement it again, and now we're starting all over again. Or as well, that you will see many times that when you get a survivor that we've experienced, you get a survivor on the phone and you start the questionnaire again, they're going, are you kidding me? I just answered this, yesterday and answered it the day before and the day before and the day before. Who is going to finally get me to the resources I need? So duplication happens, and we have to identify that. One of the things that we have implemented, and again, this is internally, is that we have developed a portal that manages and keeps up with the information that is trackable across the scope. And again, depending on who we are performing or have been activated by, has this access. And of course, it's secure. It has to be with PII, and we allow them to be able to access that to make sure that we are giving a. And what we want to say is the database of all databases, making sure this is the central database of where they're going back to, in this case, to take care of survivor Dwight Graves. He's been contacted this day, this time, and we give all the case notes and what they've been assisted with thus far. DRCs are helpful for that, because a lot of times they have a program already in place and we're tagging on to what's been implemented at the DRC. And so you keep that, but duplication does happen. Lisa, any other comments on that?
Yes, I think it's critical to know, though, that it is difficult. We have to acknowledge that it is difficult to have a centralized platform that not only case managers use and governments, but also community partners to share, so we can all see what's going on within the community on the assessment of needs, because we know that they evolve, and also the resources that have been identified by providers in order to assist with those needs. So confidentiality, all that needs to come into play. As we talked about, the ethical standards, it's very minimal because that wasn't the focus of this presentation, but you're not going to see that. And that's why you will often see duplication of services and resources, which is often very stressful for the survivor. But I think the one thing that we can say that is essential is if we coordinate better together. Coordination is key. Welcoming from the community, especially if you allow for external support to come and help to understand your community better on how we communicate and how we provide assistance is key. Integration is key within that coordination, so we don't have to reiterate and duplicate efforts. So as an example of the Resource Coordination Center and the MARC, those are two very different things, right? But they all serve a common goal. But if you have a DRC, a MARC, and an RCC open and they're not sharing information, you're already duplicating efforts at that point. And you can't say that survivor has not already gone to all three locations. So those are the things we all have to think about, is collaborating at least is key in communicating while we, meaning every state, works together, identifying and tailoring what they think is the best database for them.
Excellent. All right. Unless I'll give you one last, because we have a couple of minutes before I give closing remarks and then pass it back to Karen. But if you had a question, to unmute at this time and ask. All right, Bernice, you're up.
So Lisa raised such a great point concerning her comment concerning the duplicate of benefits, because I mean, you think of this is the season coming up, Christmas time, and oftentimes those who know the system will go from one church to another church to another church to get things that churches may offer during the season. And that often can occur when we have a disaster situation as well. Those survivors who know the system will have those duplicate of benefits from different entities because they know the system. But if the system in a whole is talking to each other and sharing information, it prevents such things, correct?
I think you're spot on, and Lisa's
That's
nodding
correct.
yes too.
That's correct, Bernice. I think one of the critical things that we need to know too is, as I mentioned, is when emergency operations centers are open and we're following that planning P, that also shows that we work off a battle rhythm every operational period. So every day it's something different, and we're working off the same objectives, right? But the only way we can make objectives seem like they're helpful or at least make sure that we're focusing on what's happening, is the people that we're bringing to the table. So if we're not bringing in those local communities and saying, hey, this is what we're dealing with, and this is what we're seeing, and this is how we need to track survivors and where they're getting resources, case managers won't be able to do their job, nor the providers that are trying to provide services at the same time. So again, that all that collaboration can be done within that EOC. Is just making sure we bring those partners in and provide that transparency and situational awareness.
Excellent. All right. So at this point, Lisa, any last comments before I conclude?
No, thank you again very much. I really hope that this presentation was helpful to you all. I really wanted to be sure I highlighted the critical points, but again, the intent of this was to really show how emergency management and disaster case management need to work together and how they need to be integrated in response, not necessarily recovery response. Thank you again for your time. I really hope this was beneficial to you all. That's it, Dwight. Thank you.
Excellent. Thank you. And so in my closing, me as well, thank you for taking the time to join us. It is a critical conversation that needs to happen for disaster case management. And we're seeing it from the rooftops because we've seen the impact to survivors and continue to see that in everything that we do. So just everything that we have seen in the past with Milton, Helene, you know that, as well as the Maui fires. As Lisa mentioned, we hope that we provided you some valuable perspectives, hopefully some actionable strategies moving forward, so you can prepare on your side for disaster preparedness, response, and recovery. But also, as I said, please feel free to reach out to us with any questions. Lisa's provided you her email, LA. It's 0915@nationalemr.us. You also can find us at www.nationalemr.us. That's our webpage that we have everything there and have links to info at being able to click. And if you have anything, follow up on us. This will be recorded, so you can fall back to that if you go back and listen to it. As she mentioned, that it will be put up on the YouTube channel for NEMA, and we thank them for the opportunity to be here. But we look forward to continuing to work together and build resiliency in all of our communities nationwide. Do not leave on this. I'm going to say stay safe and have a great rest of your day. And I'm passing back to you, Abby, for the last slide.
Thank you very much, Dwight and Lisa, for sharing your expertise with us today. And a huge thank you to the National Emergency Management and Response for sponsoring today's session. Thank you also to all of you for participating. I think it was so informative and a great, thoughtful discussion and excellent questions. You can find out more about NEMA and the Empowerment e-learning series from our website, www.nemaweb.org. And as a reminder, there'll be a short survey coming to you via email, and we hope that you'll take a few minutes to complete that. The webinar recording will be available soon on the NEMA YouTube channel, NEMA for You. Thank you again for attending. Take care, stay well, and have a productive rest of your day. Bye, everyone.